Hey everybody, quick question for you today. How many of you have knee pain when you get up from a chair, go upstairs, even just walking throughout the day? I've got a couple tips for you today, 3 in fact. So first, something to understand about these bones is that the kneecap does move on the femur or the thigh bone when you get up from a chair or when you go back to sit down in the chair. Specifically, when you go to stand up, the kneecap glides up. And when you go to sit down, it moves down. So if you take a look here, I drew an outline on where my kneecap is in a bent knee position. So I want to show you a technique that you can do easily from a sitting down position, and it doesn't require any tools or equipment, just your own 2 hands, even just one, and your knee. So I have here first, what I'm going to show you is called a patellar mobilization. It's a technique that we do in PT a lot of times. It's very easy and safe to just get the kneecap gliding a little bit better on the femur or the thigh bone. So if you want to come in a little bit closer, as you can see, I drew an outline on where my kneecap is sitting. I'm going to take my index finger and my thumb, and I'm going to find the side of my knee cap on the outside and the side on the inside, right about in the middle. I'm going to just gently then move it side to side while keeping my leg very relaxed. If I tense my leg up, I'm not able to move the kneecap. It's going to be stable at that point. But if I let it relax, it should gently move side to side. And I'm not going to be overly aggressive with it. Just kind of push it and glide it side to side. Again, this is called a patellar mobilization. And we can do about 20 gentle movements side to side. The second technique is a technique that I find is helpful for bending your knees with less pain. So what you can do is scoot to the edge of your bed or a chair, and then you're going to find 2 different points. I've drawn them here close to my knee. The first one is on my quadriceps here. The second one is right about where my IT band inserts into my kneecap. So what I can then do is take one or both of my thumbs, place them on the quadricep, or where I've marked down here. And then first I'm going to extend my knee out, lifting it towards the ceiling. And then I'm going to pull it back towards the bed or the chair to whatever range is comfortable for you. So I can go up with it, and then as I come down, I should feel some tension right here where my fingers are pressing. If it's very painful, try not pressing as hard or don't bend your knee back as far. I'm then going to switch to my lateral side. And if you come around to this side, you can see where I'm pointing to, right about where that IT band inserts to the patella. So I've marked that down. For me, it's roughly about here. Taking my fingers, pressing into that region. And then I'm going to do the same thing, bringing my leg up, extending it, bringing it back down towards the table, or if you're at your home, towards the chair or bed. If I feel little crackles or little bits of popping underneath where my fingers are, but there's no severe pain, that's likely okay. That could just be related to tight fascia. So the third technique is something, again, that you just need your 2 thumbs for and your leg. So I'm going to scoot back here on the table. I'm going to find for this one my anterior tibialis muscle. So what I can do is find my shin bone, okay, and obviously it's going to be very hard because it's a bone. If I go directly lateral or next to it, I can get to something soft, and that's my muscle. If I take my 2 fingers and I just gently press into that muscle like I'm going to pull it away from the tibia or the shin bone, kind of pulling it down to the outside, this is another good trick to help release tension throughout the leg, help reduce knee soreness. So I can go couple rounds here. Maybe I want to go 3 times through. Again, just pushing down gently that muscle away from the bone. And then if I again come to the bone and I come more to the inside of the leg, I can push towards the calf muscle. Doing that same thing, just kind of gently pulling the muscle down away from the bone. And I could do a couple passes on this as well. And so with that, those are going to be your 3 tips to help you with knee soreness. Again, I'm Dr. Austin Bruhl for Tip Tuesday. Like us on Facebook, follow us on Instagram, and subscribe to us on YouTube, and we look forward to sharing more content with you soon.